Okay, I want to thank everyone for coming today. We're gathered here today to release another report about the rising cost of health insurance, but more specifically today, to look at some of the abuses that are going on within the health insurance industry. And really what I want to highlight today is that some insurance companies are doing their job, they're able to provide efficient care, and some of them are not in any way and are costing taxpayers and hardworking people across the state of Wisconsin a lot of money. Now, the report that was released today has been compiled by Citizen Action of Wisconsin, and it basically shows that Wisconsin families are paying $1.5 billion more than they need to, and that $1.5 billion is not being spent actually on medical services whatsoever. The most wasteful category of health insurance is that which is bought by the individual on the market, not the group market. And more than double the percentage of premiums on the individual market are being siphoned off by insurance companies. That is, if you buy insurance as an individual, you're twice as much money that you're paying to the insurance companies is being siphoned off to those insurance companies. Now, whether those are for administrative costs or for profit, pure profit, is unknown, and that cannot be deduced from records. But it is known that there are some insurance companies that are far more efficient at what they do, and some that are far less. For example, Dean Care and Gunderson Lutheran are able to spend 95 cents for every healthcare dollar going back to medical costs, whereas an insurance company such as United Healthcare is actually taking 25% of what people are paying as individuals to the health insurance industry. Now, what does that mean, 25 cents per every dollar that they're skimming off? Well, that equates essentially to $200 million across the state of Wisconsin. That's a lot of money, hard-earned dollars for people all across our state, families that are looking to be able to pay for the additional gas costs, additional heating costs this winter, and of course other costs for food and such. So, insurance companies have proven across our state that they can do things more efficiently, but some have failed to do so and are costing our taxpayers a lot of money. Today we're joined by members from Eau Claire and Altoona who are concerned about these developments and are pressing our state legislature in the next session to do something about it, to clamp down harder on this sort of wastefulness and inefficiency. And with that, I would like to give over the podium to Jo Rudrud from Altoona and just allow her to say a few words about her healthcare story and then wrap things up. So, thank you, Jo, for coming.
Hi, I'm Jo Rudrud, and from Altoona. I had group health insurance through a former employer and was covered for any health problems I had, and I developed a heart condition, atrial fibrillation, and a few other things. And that was all covered. When I left that job and went to another job where there was no group coverage, I was forced to buy individual coverage, and I was told by 7 insurance agents that I should quit my job and go back to a place where they had group coverage because I wasn't going to be able to get any health insurance, which turned out to be the case. So I had no health insurance, wasn't able to get coverage. I now work for an employer who does have group coverage, and when I interviewed for the position, they said, oh sure, they've got $1 coverage with a real small deductible. I took the job, and 2 weeks later when I actually started the job, they'd had to give up that good coverage and go to a real high deductible. They couldn't afford to have the previous plan anymore. So once again, I have relatively no coverage. My cardiologist has called me every week for the last 2 months to say, you need to come in, and I haven't been able to go in. I can't afford to go and have my heart condition monitored. So and I'm just one story. But that's pretty much the position the insurance company has put me in. Personally, I'm sure there are other stories like that out there. But so anyway, well, thank you very much.
Thank you, Jo. And I want to say once again that we're looking toward the future and we're looking toward plans. And right now, if you're looking at the national scene, this should be something of concern to voters. that more and more people are being pushed to the individual market, and plans that are being offered right now are saying that they're trying to push individuals to the market to fend for themselves, essentially. Now, with the abuses that we've outlined again today, which are happening to individuals trying to shop around and on their own against these big corporations, that should be a major concern to people who go to the polls this November and are looking for health care reform. With that, I think we'll call it a day, and once again, thank everyone for coming. Keep up the good fight. Never back down. Thank you.
It's like 25% now of people in the country have inadequate coverage.
Underinsured.
Or no coverage.
Yeah.
Underinsured. But I mean, serious.
Well,
And, with this economy collapsing,
Yeah.
what's going to happen now with money being so tight, so unavailable? It's just going to, that number, that 25% is going to grow.
I'm interested to see